Welcome to Medheads, the weekly show that brings a biopsychosocial focus to issues of the day, along with special guests who will showcase their expertise and enthusiasm about their field of practice. Your host, Dr. Fergal Armstrong.
Hello everyone, my name is Dr. Fergal Armstrong and welcome to Medheads. Today we have with us Craig Payne. Hello Craig, how are you?
Yeah, great to be here again, Fergal. Thanks, mate.
Welcome. I thought today we'd think about isolation. So, I mean, the elephant in the room is the fact is we're filming this during COVID, and Melbourne is in lockdown. So there's a lot of people suffering from isolation. So we need to bear in mind that when we're talking in generic terms about isolation, that this is actually affecting a significant number of people in our society. So what's your view of the effects of isolation, both on drug use and also on recovery?
Yeah, and I think that's where it ties in with COVID at the moment too, because one of the things I so often hear and people talk about is that isolation is, the addiction just causes isolation, and traps them further in it. And from a treatment perspective, as far as COVID goes at the moment, it's really difficult because one of the things we're encouraging people to do is to, as part of moving forwards, is to get up, to make new connections, to start getting out and about, to start, creating this new routine and these new interests and all this stuff. And they can't do it at the moment. So it really feels like they're right up against it. And this is, well, do I stay in the addiction, or how uncomfortable can I be in all this? So yeah, it's really a difficult time to be looking at recovery.
So we know that the more lonely the people feel, the more they tend to use drugs. And that was research that was actually published this year. In response to COVID, the question was, does isolation worsen substance use disorders? And quite frankly, the answer is yes, because when you're at home on your own, you've got nothing else to do, you've got a substance use disorder, well, it's just very easy to fall back into those habits, isn't it? So it's important to realize that. Go on.
Oh yeah, no, I was going to say, well, I think the thing with the substance is it makes doing nothing okay. No matter what it is, or any sort of addiction, it makes doing nothing okay. It gives nothing this false level, this false high. Yeah. And so sitting on the couch, sitting at home, folding the washing, doing these things in isolation, it feels good to do it. But slowly, as we know, it's actually causing a lot of damage and eating away at things as well in the background.
And then you said something interesting, that drug use causes isolation. Tell me about that.
Well, it becomes your only focus, and it becomes your only activity. And because, look, people drink and do drugs because it makes them feel good, yeah? It's in the beginning, this is the thing, it makes people feel good. So, and that's what they start to chase. And it might all of a sudden seem better to stay and have a drink than go for a walk down the park. It might seem better to have a smoke instead of catching up with friends at a party, or maybe you continue the party on when you get home alone, but slowly it takes over and you stop doing all the things that you used to do.
So of course that's one of the diagnostic criteria, isn't it, that for DSM-5 is a loss of activities. So you lose all of the activities that anyone who's not dependent on drugs has. So like visiting friends, going to the shops, going for coffees, meeting out for meals and things like that. And that range of activities just gets smaller and smaller and smaller until it basically becomes all my activities are related to either acquiring drugs, using drugs, or recovering from drugs. So your circle of activity just shrinks, doesn't it? That's a DSM-5 diagnostic criterion.
Yeah, okay, yeah. And I think the point you make there about recovering from drugs is a really good one, because that's another thing that forces into isolation as well, is the hangover and the come down. Like maybe you've got plans for the next morning. Well, they don't happen because you're too hungover to do them. You plan to catch up with friends, you plan to go out somewhere, but basically, or and with some drugs, there's effects 2 and 3 days later, and and so that prevents you from doing the thing. So I think quite often we focus on the good on the feel good, but it's the withdrawal side of things that plays a major part in the isolation, and then the build up of guilt and shame, because you're not fulfilling what you said you were going to. You're not holding yourself up to your own standards.
Yeah. So isolation causes drug use causes isolation, and recovering from drug use also causes isolation. That's the point you're trying to make, yeah? Yeah.
And so as you go on, the deeper you get into it, you just end up at isolation. It happens slowly, but then as use increases, as these things increase, you just end up you just end up isolated. And so many people I hear are my existence now is sitting at home and drinking on my own or using on my own, and my only interaction is going out and seeing dealers or seeing the bottle shop attendant. And maybe seeing 2 or 3 bottle shop attendants, so that you don't to try and hide the shame of going to the same one all the time as often as you are. But and again, those feelings build up and the isolation continues.
So you've said in other situations that actually engaging in recovery, certainly the early steps of recovery, is also isolating, haven't you? Because you're moving away from your drug using peer group, and you haven't yet found your new tribe.
Yeah, it's a really difficult transition stage for some people. And again, so many people come to recovery with broken relationships, not many real friends, pushed family away. They're feeling so isolated already. And then so that they haven't got a lot to fall back on. And it can be hard to face up and mend those old relationships, and especially in the early stages of recovery with the guilt and shame. So it's fine, and often they've lost track of who they are and what they actually want that next picture to look like. And trying to figure that out alone it's an awful place to be.
Yeah. There's also an idea about I think we need to emphasize that there's a difference between isolation and feeling lonely, isn't there? Because it's possible to not be isolated, but to still feel disconnected with people and feel lonely. So, for instance, before COVID happened, there would have been a lot of people living in Melbourne, in the middle of a big city, who did not experience the benefits of social connections. So they would not have been isolated, but they would have felt lonely. And it's actually loneliness, I think, that is the key emotion. What do you think?
Yeah, no, that's a really great point. And I think in a lot of ways, sometimes people can isolate in the company of strangers. Yeah. And by that I mean that's where they go to the pub, and maybe they sit in a pub all day because their pub is their only social circle. Or maybe it's a gambler who goes and hangs out in the TAB or some sort of venue like that because they're around other people. They may not really engage in much conversation, or maybe that's a little bit of conversation they have, but that's the only social connection they have. And that's the only thing that actually gets them up and out of the house each day. So it's still, quite a lonely existence because it's not a real friendship. It's not based on anything other than those interactions for a few hours in a licensed venue or somewhere. So I think quite often, people can isolate in the company, and it makes the picture seem a little bit better than it actually is.
And of course, these are almost as good friends as Facebook friends. When we're talking about isolation, loneliness, and human connection, we're actually talking about, physical relationships, emotional relationships. We're not talking about having hundreds of followers on Facebook or having a couple of blokes that you kind of punch shoulders with at the pub or the TAB shop. But it's also important to remember that, we're in COVID, these bars and betting shops are all shut. So even that small degree of human contact that was available now is no longer available, isn't it?
Yeah, and I think again, and that's driving people further into the addiction as well, because it's almost made the like, say something like gambling, at least if someone's getting up to go and do that and they're getting out and about, that's filling in time. But if they're just sitting at home and that's purely what they're doing from wake till sleep, then they're probably in a lot more trouble. And the same as drinking, the same as drugs. If that's the focus from the minute you wake up, then and that feeling of isolation and loneliness is exacerbated, then you know you're just going to drink more and more, and that guilt and shame's building up.
So it's actually quite a dangerous time for a lot of people with addictions. I mean, I'm thinking about gamblers. You know, they've got nothing else to do except go online.
Mm.
I mean, the
And there's a
pokies.
lot more places popping up too.
Yeah,
Everywhere's going online. I
yeah.
was talking to a guy recently who a lot of the bookies that were track bookies have actually turned their business online, and they're ringing customers and they're actively trying to recruit people.
Really?
Mm. So yeah,
Right.
and so like if you're sitting at home and you've self-excluded from all this stuff and you're doing the right things and you've said, blocking your avenues to gambling, and then you're getting phone calls or getting messages and things to say, hey, come and join us. That's going to be pretty hard to resist at a time of weakness. It's the same as deliveries from bottle shops, deliveries from, dealers. It's sort of everyone's looking at a way to keep you trapped, and to feed off the isolation.
Yeah, deliveries from bottle shops. I'm not sure how I feel about that. You know, it's the same as takeaway food, takeaway booze. Do you think it's a good thing or a
Yeah.
bad thing?
No, I don't think it's a good thing at this time at all.
Yeah,
It's one thing to have kept the bottle shops open. You look at so many other businesses that have closed down, but these ones are open. And I'm looking long term at the moment. They're already talking about people having increased their drinking habits, and there's the 66-day advertising that's going on at the moment as far as forming a new habit, and that's what people are doing. And um, and and
what
now
is the
they know they can
66
get it
days?
delivered.
What is the
Well, they're
66
just saying
days?
that it takes 66 days to form a habit, and lockdown has well and truly surpassed that at the moment. And
Right.
the studies are already suggesting that alcohol consumption is well up. People are drinking more often
Yeah,
than they were,
yeah,
and as restrictions have eased a little bit, those levels of drinking are remaining. People
yeah,
who may have come home from work one or two nights a week and had a drink
yeah,
are finishing work at 5 o'clock and drinking every night.
yeah, yeah. So, I mean, some of the evidence that I've read is that women are drinking more because they're having to cope with the burdens of childcare because their kids aren't going to
Mm.
school. And men are drinking more because they're having to cope with the psychological burden of unemployment. So you factor in unemployment, isolation, and employment is so connected with your self-esteem and your social identity. You take that away, and then of course you've got this complete vulnerability to alcohol. I mean,
Yeah.
interestingly, in terms of other illicit drugs, I mean, I've read research that suggests that actually the biggest impact on illicit drugs is the lack of availability of MDMA, ecstasy. And we're not really at the moment seeing significant changes affecting the market for heroin or methamphetamine. Certainly not in the research that I've read, but the ecstasy for some reason is hard to get by. And reassuringly, I've also read research that suggests that access to drug treatment services during the time of COVID has not actually been impaired. There was a paper I read that said that only 7% of users felt that access to drug treatment services had been difficult. Mind you, that research
Uh,
was published in the earlier months of COVID, and I don't think we really know the effects of what's going on right now. Because, as you say, this lockdown has lasted a number of months.
yeah. Yeah. Well, as far as the treatment side of things, I'd say it's well and truly been impacted now. In
Yeah,
fact, I know it has.
yeah. In what
The
ways?
the well, the wait lists have blown out,
Yeah,
and the access, especially to rehabs,
yeah,
is a lot more difficult. We had people who, maybe they'd be told that the wait list was 6 weeks, but because of different circumstances, this is pre-COVID, they may end up getting a bed within a week or 2 weeks, or or 2 or 3. Like it could be a little bit quicker. Now we're looking at months for beds. Now we're looking at it's rare that that the opening will come up earlier as well, because what limited beds were available have been cut because of COVID. Like they're not having that many people on site. So it's difficult in that sense.
So not only is there an increased number of patients with problematic alcohol consumption or other illicit drug use, but actually the number of beds that are available to treat these patients has been cut. That's what you're saying.
And I think, but as well, there's also, as far as the counselling side of things, now that that's gone online and can be done telehealth style, what I've heard is feedback I've had is that that's been a real win, because people are able to do it from their home and they're much more likely to turn up. Because they don't have to go to the trouble of coming in for an appointment and doing all these things, and they can do it from home. The attendance rate at counselling sessions is a lot higher.
That's an interesting segue into this debate about, is it a valuable exercise to consider online peer support groups? We're talking about isolation, causing, substance use disorders worsening. And that we're talking about, the internet causing or facilitating consumption of alcohol and consumption of bedding. What about the consumption of treatment services? How do you view online treatment services?
And look, I know, funnily enough, in about 6 weeks, I'll be starting an online peer support group through our organisation. Because it's been called for at this time. And I've had success with it through another project I was involved in. And so, definitely. And look, I know a lot of people were hesitant at the start when smart meetings, when 12-step, when all that went online. People felt that they didn't quite have the connection, and it wasn't the same, and were a little bit more hesitant to log on. But once people have logged on, they've actually discovered that it might be the only form of connection they get with the outside and with other people trying to go through recovery at the moment. So, and they've found little communities as well. I know just one of the meetings that I was facilitating, we built up a little regular following for that one. It was something for people to look forward to each week, and some of them were doing 2 and 3 meetings a week online, and it was a real win for them.
So what would you say to those people who are frightened of going online for these meetings? Some of the patients that I look after, now the irony is that I'm looking after them online, and I say to them, okay, so you've seen me online, I want you to now go and join a support group online, and they put up barriers to that. Why do you think people are putting up barriers to accessing supports online?
I think whether it was online or not, some people would be putting up those same resistances. But for a lot of people, they want that face-to-face. For a lot of people, they don't feel comfortable. Like there's internet security, for there's little paranoias around that for people that, and because I know early, who's actually watching, because it is just open to the public and anyone can jump in. They're afraid of maybe seeing someone they know or being found out, and maybe that the anonymity side of things is gone. But the thing with the online stuff at the moment is for a lot of them, or some of them, you can join with your camera off. Some will ask for camera on so that they can guarantee that you are alone. And I think it's just a chance to connect in a really difficult situation at the moment. COVID, there's not much connection going on, so this is a real chance to do that. And I would just encourage them to log on and sit. You can always log out if need be. If it is seeing someone they know that's a worry, then just you're at the click of a button and you can just leave and you can go join a new meeting. I mean, you can join meetings all over Australia, all over the world at the moment, and make new connections.
So in that regard, you could argue that COVID has actually increased access to treatment. COVID has actually made us more connected. You could argue that, couldn't you?
Absolutely. So, in one of these meetings we were doing, had people from Sydney, from Queensland, from South Australia, people from everywhere. And that actually adds to the anonymity as well and adds to the experience.
So actually, your anonymity is protected because if you're in Melbourne, you can join a group in Sydney or Western Australia, and no one's going to know you. So you're actually in more control.
You've got just as much chance bumping into someone in person at a meeting as you have online. So, and never forget that you're both there for the same reason. So both of you probably don't want it getting out at that stage,
Yeah. So, I was very interested to hear what you said. When I just asked you about my patient who didn't actually want to go online, what you're actually saying is he just didn't want to join a peer support group. He wasn't ready. And we've talked about the reasons why people may not be ready to join a peer support group in previous discussions. Let's now move on to, the role that isolation plays in the journey to recovery, and how damaging is it in terms of actually engaging in recovery and its consequences upon relapse?
I think that the mental health side of things plays a really big role. And so the further the isolation can eat away at mental health, the more urge there is for people to seek some relief through a substance. And so, being on top of the mental health side of things is really important.
You've said in other fora that you've said that there's no such thing as a lone ranger in recovery. I use that line now quite a lot because I think it does emphasize the fact that recovery is a group effort. You cannot do this on your own, and if you think you can, you're really deluding yourself.
Yeah, absolutely. You need to create some sort of connection. You need to create some form of recovery program, and this is your option at the moment. You mightn't like it, but you're not going to like a lot of things moving forward either. Life's going to throw these things up all the time. So it's about looking at it and saying, well, this is the solution and this is the solution I've got. So if I'm going to make a fist of this, I just need to bite the bullet and do it.
Yeah. There's no other option at the moment. It'll be interesting to see what happens when we get over COVID and when we start having other options other than online. To what extent will people, having become used to online, then continue to pursue their recovery online? And I think there will be a significant proportion of patients who will choose to do the online option. But then again, there'll still be the people who still want to do the face-to-face. I think we're now in a world now where we're accommodating both.
Yeah, and I think it's going to really help people with their balance, with the balance of life. They can just dial in from home, and it doesn't. An hour meeting doesn't need to take up 2 or 3 hours with travel time and all the rest of it. It's actually a lot more convenient moving forwards. And I wouldn't be surprised if there are a lot of meetings that do remain online and people stay engaged that way. I think the options will definitely increase. But I think on the whole, a majority will want to go back to face-to-face. But to have those options available is definitely going to be really good moving forwards.
So isolation, does it impact upon relapse?
Yeah,
Feeling
big time.
lonely.
Because it's a form of relief and it's a form of connection. And like we've said, left alone to self, we can justify anything. We can turn anything into a good idea. We can justify that just one. And again, it just comes down to that creating yourself a meaningful day, a meaningful existence, a purpose for each day. And if you're alone and isolated, the urge to seek relief in a substance is going to come back, and it's going to be harder to fight.
So it all starts, of course, with giving yourself permission, doesn't it? Which is not necessarily giving yourself permission to take the drug. It could be giving yourself permission to not go online, to not reach out to people, to miss a meeting,
So that's right.
to miss a group. That's when it
Yeah,
starts,
and we
isn't
need
it?
to be yeah, we need to be sharing these things with people. We need to be sharing the fact that maybe you're struggling, that the thoughts are returning. Need to be normalizing that and getting them out of your own head, and finding some guidance and some relief from others. And yeah, just by sharing that, other people will be able to help you work through that.
And so it's really important to recognize that isolation, whilst it may become attractive to you, it's like a siren. It's calling you onto a rocky shore. You need to deal with it. You need to reach out.
Yeah, and it's that balance thing, like I think we all need time alone. And I know personally I really value time alone. I like my own company. I like having my space, but too much of it's not a good thing either. We
Yeah,
need to be out there doing things with people. So yeah, just being really aware of where that balance sits for you is pretty key.
yeah, yeah. All right, Craig, we've run out of time as usual, but before we sign off, can you just say one summary point about the impact of isolation and how we deal with it?
Uh, yeah, I mean, look, isolation's killer. So again, trying to plan a day, a week, a routine, trying to make sure that you've got a good balance of connection and meaningful activities within your week is going to be really important moving forwards.
Craig, thanks very much. We'll speak to you soon. Thank you.
Cheers, Fergal. Thanks, mate.
That's it for today's Medheads. My name's Dr. Fergal Armstrong. We'll see you next time.